Hi everyone. Today I'd like to discuss self-care for Master of Social Work students who are living with mental health diagnoses. Many MSW students enter the profession because of personal experiences with mental health challenges, trauma, recovery, or supporting loved ones. While these lived experiences can strengthen empathy and understanding, they can also create unique stresses as students navigate coursework, field placements, and personal wellness. Through the lens of the NASW Code of Ethics, I will focus on the ethical principle of competence and why self-care is not only a personal responsibility, but also an ethical responsibility for future social workers. The NASW Code of Ethics states that social workers should provide services and represent themselves as competent only within the boundaries of their education, training, and abilities. Competence requires us to remain aware of factors that may affect our professional judgment or performance. As MSW students with mental health diagnoses, we may experience periods of increased anxiety, depression, ADHD symptoms, PTSD responses, or other mental health challenges. Graduate school can amplify these symptoms through academic pressure, emotional client interactions, and field placement responsibilities. Self-care is often discussed as something optional or as a reward after completing our work. However, I would argue that self-care is an ethical obligation because our well-being directly affects our effectiveness with clients. Examples of self-care include maintaining therapy or psychiatric appointments, taking prescribed medications as directed, creating healthy sleep routines, establishing boundaries between school, fieldwork, and personal life, engaging in peer support and supervision, practicing mindfulness, exercise, or other stress management techniques. When we neglect our mental health, we risk burnout, compassion fatigue, impaired judgment, and decreased effectiveness. This can ultimately affect the quality of care we provide to future clients. An important reminder is that having a mental health diagnosis does not make someone less capable of becoming an excellent social worker. In fact, many professionals use their lived experience to enhance empathy and understanding, while also maintaining strong professional boundaries. The key is recognizing when support is needed and seeking help before challenges begin to interfere with functioning. One challenge many MSW students face is feeling pressure to appear resilient at all times. Because we are trained to help others, we may feel uncomfortable admitting when we ourselves need help. From an ethical standpoint, competence includes self-awareness. If we encourage clients to seek support during difficult times, we should also model the same behavior for ourselves. Practicing self-care demonstrates that mental health recovery and wellness are ongoing processes rather than destinations. It also helps reduce stigma within the profession by normalizing discussions about mental health among social workers and students. I'd like to hear your thoughts on the following question. How can social work programs better support MSW students who are managing their own mental health diagnoses while completing academic and field placement requirements? Additionally, what self-care practice have you found most effective in helping you maintain your well-being while balancing the demands of graduate school? In closing, self-care for MSW students with mental health diagnosis is not simply about feeling better. It is about maintaining professional competence and preparing to serve clients ethically and effectively. Thank you for listening. I look forward to hearing your experiences, ideas, and recommendations. Thanks.